Okay, so why did I start CPD Formulations? Well, we have to go back a few years to 2007 when I was a psychiatry registrar myself. And I was dealing with getting through my clinical training on my way out to become a fellow of the College of Psychiatrists. And what I discovered from that whole experience was that although there was a lot of time spent on learning the curriculum, learning a lot of the things and skills that we know to do as psychiatrists, there was very little in the way of support, education, formalised training around the non-clinical skills such as time management, anxiety management and presentation skills, which come to the fore in things like clinical exams. So the types of programs and services that we offer has changed greatly over the years. Initially, it was small group-based training, so 6 to 8 people over a weekend, running through the basics of presentation skills and role plays leading up to the last day where candidates would actually present cases, be filmed and get constructive feedback about how they present. So I'm finding now that the challenges that these registrars are facing is just access to clinical cases, access to quality feedback, access to desensitisation, and coming together in group environments is always a wonderful thing to watch. And every time we run a workshop or a presentation, seeing registrars flying from different areas of the country and meeting people they wouldn't normally meet and actually having that light bulb moment that, hey, it might not just be me that's in this situation, it might actually be that a lot of registrars feel like me. Often we're asked if registrars can practice on real cases, and that's applicable at certain times, particularly if they're cases that they may not see in everyday practice. But we actually love working with professional actors as well, because in some ways working with a professional actor is actually trickier. You can script a professional actor to behave a certain way, for example, to be difficult in an exam, to give a registrar real in vivo desensitisation to what it's like to actually manage an interview, not just manage a patient, if you know what I mean. So we use a lot of professional actors here, and some of our regulars have appeared on many of our DVDs, and we've had road shows, and they've got to know us very well. They're extremely conversant when it comes to understanding the exam process. And then the other lovely part to that too is working collaboratively with those actors who also have fantastic non-clinical skills, if you like, as well, such as presentation skills, performing on the spot, being present when you're presenting your case to an examiner. So we rely then on their expertise as well. It's kind of like a little family. So what we actually focus on in CPD is both components of the clinical exam. So that's the 50-minute OCCE, which is the observed clinical interview, and a lot of that is the group-based training and the one-on-one training. But what we have actually also rolled out this year is mock OSCE exams. Now, OSCE exams are a big component of the clinical exams, and it's getting harder and harder to find a place at a practice exam before the real thing. There's a lot to be learnt about how to manage 3 hours of multiple stations of around 10 to 20 minutes each. So we've actually set up this year and run successfully 2 mock OSCE exams using examiners who are accredited with the college and professional actors as well, and offered places to registrars so they get a real chance at in vivo desensitisation. And we're very proud to announce that we've just released also our latest series of stations in a complete book as a DIY OSCE kit, so that you can take them away with your study group and actually use the stations. What I'd like to see for CPD happen over the next few years, and I'm really excited about it, is to extend our range of products, DVDs and services that we can offer. We're at the brink of launching into social media, getting more online presence, being able to deliver webinars, up-to-date content, expanding the portfolio present to pass so that it doesn't just become a one day or 2 day coaching workshop, that there is pre-coaching materials and courses to do, and then more work to do after the coaching day. The other area that I see that this is particularly relevant to is also the overseas trained doctor market, those international medical graduates that come to work in Australia and to complete their fellowship training here. There's no reason why we can't reach them before they arrive in Australia and help them with understanding the college exams and how the best way to move forward would be for them as well. Anytime I work with registrars, it's lots of fun and very rewarding. Working with the registrars themselves is not a challenge. It's a great passion of mine.